La Crosse County started the year with as many as 4 potential suicides. News 8's Madeline O'Neill has more on how local hospitals are trying to intervene.
Martha, Gunderson Health System recently updated its system of screening patients for suicide and now use a questionnaire at every physical and hospital stay. Mayo Clinic Health System has a questionnaire they use as well. Health officials agree that the first step in addressing suicide is asking the question, "Are you okay?" Medical professionals like Dr. Michael Dolan know firsthand how devastating suicide can be.
Early on in my career, I saw an elderly gentleman, diagnosed him with something that was completely fixable. We had a plan in place. His daughter asked him what the doctor said, and he said, "I'm going to die." And 3 days later, he killed himself. And I remember that day like it was yesterday.
So he wants as many people to be screened as possible. And now Gunderson patients, whether they're in for a hospital stay or for an ordinary physical, get a short questionnaire with simple questions.
Have you ever thought about killing yourself and how you might do that? If you ask the question, if you just screen, it gives you an opportunity to intervene.
At Mayo, employees use a depression screening questionnaire to determine what level of care a patient needs.
The screening tools such as this do help to identify who are the patients that really do need a psychiatrist, who are the ones who maybe just need some education on coping and other mechanisms.
But it's not just doctors who should be asking the tough questions. Health officials say it's on the rest of us, too.
You need to ask the question, "Are you okay?" and go beyond that to say, "Are you thinking of hurting yourself?" You have to ask the question and follow up with persuading them to live and referring them for help.
And it's hard. It is really hard. These are uncomfortable questions that we have been programmed really from birth not to want to ask. But we need to get over that discomfort and ask those questions, because that is how we're going to stop this epidemic of suicide.
Dr. Dolan told me today the screening has already worked as they hoped it would in a case where a man was determined to be high risk for suicide and got the help he needed. If a patient is high risk, Gunderson intervenes and requires they get a behavioral health consultation.
Thanks a lot, Madeline. Also, patients in the hospital get the questionnaire both at the admittance and before their release. So if you or someone you know is experiencing signs of being suicidal, Great Rivers 211 can connect you to resources by dialing 211 or even going to their website.